If you or a loved one have received a Crohn's disease diagnosis, you might feel overwhelmed and concerned. The patient journey can be long and complex, but with the right tools and support system, you can lead a healthy and balanced life. Typically, the journey starts with symptoms that might include a combination of diarrhea, bowel urgency, incontinence, abdominal pain, cramping, weight loss, lack of appetite, fever, fatigue, rectal bleeding, anemia, nausea, and vomiting, as well as fissures, abscesses, and/or fistulas in the rectum and anus. You might even avoid eating because of how much it hurts going through your system, or avoid going out because you are worried about your bowel habits. These can appear at any age, often beginning in children and young adults. Symptoms can be relentless, embarrassing, and scary. After experiencing these symptoms, which can be severe and greatly affect quality of life, most people visit a general practitioner, or GP, who will typically review your medical history and symptoms, perform a physical examination, and request some tests. There are many conditions that cause symptoms similar to those of Crohn's disease, so the diagnosis could take years to pinpoint. These delays can be frustrating and overwhelming to live through. Usually, if symptoms don't resolve, a GP will refer you to a gastroenterologist. Assessments that can help a doctor zero in on a Crohn's disease diagnosis and monitor disease state include blood tests and stool tests for biomarkers and for intestinal pathogens. Endoscopy is the most accurate tool, as it allows the physician to look inside the digestive tract from the top or the bottom for visual signs of inflammation and to remove tissue samples for testing. Other imaging scans might also be helpful. Crohn's disease presents uniquely in each person, so a diagnosis can differ by its severity, such as mild, moderate, severe, or sudden and severe, and by its disease location, which can appear in any part of the digestive tract. Crohn's disease can penetrate through the bowel wall and cause further damage if not managed. Learning about this chronic condition can take a while. In some cases, you might have a physician who provides you with many resources, whereas others might have to seek various reliable printed or web educational resources, support groups, and online communities, and individual and/or family-based counseling. The GI Society has many resources, including varied educational information and a support group. With so many medications available, along with different severities and location of disease, Crohn's disease treatment looks different for each person. Medications play a vital role and will include ongoing anti-inflammatory medications and symptomatic medications from time to time. You might have to try several different medications until you find one that works, and then, over time, you might need to change the medication again or change the dose. Certain side effects might make a drug unsuitable for you, so your doctor will change your medicine. Finding the right treatment is an ongoing process. Individuals might need surgery at some point in their journey. This can include repairing fistulas and fissures, a bowel resection and reconnection, or ostomy. Sometimes multiple surgeries are necessary. Most patients will also need to make changes to their diet and exercise routines. Even with all these treatment options, new symptoms might appear, severity might increase or decrease, so changes might need to be made to medications or new assessments are needed. It can be a network of snakes and ladders. Caring for a person with Crohn's disease consists of a comprehensive healthcare team, and this can include a gastroenterologist, nurses, registered dietitian, patient support program, mental health care professional, dermatologist, kinesiologist, ophthalmologist, rheumatologist, neurologist, and sometimes a visit to the hospital emergency. You will need routine tests to monitor disease activity and medication side effects. However, many patients experience flares, during which inflammation and symptoms return. At this point, more testing is necessary and treatment plans might need adjusting. Revisiting all the tests can be frustrating, but they are essential to ensuring your body is healing. Some patients need to arrange special accommodations with school or work. Some might need financial support, as it can be difficult to work in severe cases, and they might need help to cover their medicine costs. It is important to find mental health support throughout your journey. Remission is the goal, and this occurs when inflammation in the gut is reduced or resolved and symptoms are minimal or gone. Your journey might be worsened during difficult times when access to healthcare is strained. While the journey is long and complex, we hope you can find solutions that manage your condition. On behalf of the Gastrointestinal Society, thanks for watching. For more information on Crohn's disease or to make a donation, visit badgut.org.